Hi, everyone. Good evening. My name is Dr. Lori Cudone, and I am an otolaryngologist. I am very pleased that I had the opportunity to relocate here to Dixon and am so glad that I am able to work here at KSB. I am an otolaryngologist, which most people call an ENT, which means ear, nose, and throat. That is a that's a long word for someone who takes care of things from the shoulders up, not including the teeth or the eyes or the brain, but pretty much everything else. Um, I take care of all ages of patients from the day the patient is born until 90 years old. I treat the entire spectrum of ages. Um, I'm very lucky because often I get to treat many generations of the same family, and that really builds a tie between me and my patients, something that is really important to me. Um, some of the things that I treat, I'm going to talk about here tonight. And I think what we'll do first is kind of split them into things that I do for children and then things that I do for adults. In children, one of the most frequent things I see is children with ear infections. Those little ones have a lot of trouble sometimes with recurrent or persistent ear infections, those that don't go away. Um, Oftentimes when those children come to my office, they've already gone through the medical therapy for those ear infections, receiving multiple antibiotics, using nose sprays, those kinds of things. And so when they get to me, they have had quite a bit of trouble. Those poor little ones will have trouble with sleeping. When they lay down at night, they can't get to sleep or they don't stay asleep. And if the baby's not sleeping, neither is mom or dad. And so this can be disruptive for the entire family. Um, when they get to me, one of the things that we discuss is the possible placement of tubes. It's a very easy procedure to do on children, and it can really change the life of multiple family members. Many times the parents will tell me what a wonderful change it has been, that it's their old baby is back again, happy, having fun, being able to sleep, being able to eat without having pain every time they swallow. Excuse me. The other thing I see in children often are children that come in with tonsil problems. Those problems can be because of enlarged tonsils or can be because of recurrent infections. Oftentimes, the child is having trouble sleeping at night, being able to breathe well. They start snoring, and then we'll have these episodes where they stop in their breathing and then kind of choke or gasp. That's sleep apnea. Sleep apnea in children is different than what we see in adults. With children, if a child has issues with sleep apnea, one of the first recommendations is to take out the tonsils and adenoids. So that's why they end up in my office. But there are other things too. General breathing problems in children. Um, uh, One of the other things that I see a lot are foreign bodies. You'd be surprised how many times a crayon or a bead ends up in an ear or a nose, and that's when I see those little ones. Um, Also, speech delay, problems with hearing are other things that I take care of. Also, if there happens to be a little lump or bump in the neck or the face, then that would be seen in my office as well. Now, as far as adults, again, I take care of anything from here up, except those couple of things we talked about earlier. So, skin lesions of the face, of the scalp, the neck, those are all things that are dealt with in my office. And if they're small enough, they can be done on an outpatient basis in my office. Some of the larger lesions need to go to the operating room. And I am trained in facial reconstruction. So if any of those lesions are on the larger side, you can be taken care of in one procedure rather than having the lesion removed by one doctor and then have to go to another doctor for closure. Breathing issues in adults, and that can be anywhere from a problem with your nose down into your throat, into the voice box where your lungs are, the larynx. Um, Allergies are another thing we see quite often here in this office. We have an allergy clinic here, and we are able to do allergy testing, skin testing, and also treatment, um, such as allergy shots or drops under the tongue. Those things are useful for people that have reached the maximum therapy with as many medications as we have to address their symptoms, or for those people that may not tolerate medications very well. Um, we take care of folks that have sleep apnea through the diagnosis and sometimes with treatment with CPAP, or there are some surgical procedures that can be useful at times. Um, we take care of ear problems, hearing issues, um, ringing in the ears. Patients that have had dizziness are often seen in this office after they have seen their primary cares to rule out anything like heart disease or high blood pressure, or things like that. They come to us so that we can decide whether or not their dizziness is because of something that might be going on with their balance centers in their ears. I take care of head and neck cancer and also benign tumors of the head and neck. And we also take care of endocrine problems such as surgical um, management of thyroid nodules, parathyroid glands, things like that. Um, I am really pleased to be here at KSB, and I appreciate you taking time to be with me this evening to talk about these things. Um, I This is the first of many of these things that I'm going to be doing, and I'd really like to hit on subjects that you want to hear about. So if you would like, you can go ahead and leave a comment, and I will tally up all those comments, and the ones that are most frequent would be the ones that I'll hit on sooner rather than later. I think the next one that we're going to be doing is we're going to talk a little bit about allergy. It is going to be April pretty soon, and so the allergy symptoms are going to start ramping up if they haven't already. Um, I really thank you very much for being here tonight and look forward to talking with you soon. And if there's anything that we can do for you, we're here at Commerce Towers. Feel free to give us a call. Have a great night.